Well, with all the focus recently on the swine flu, there's a virus that's still out there and it can be deadly. Dr. Michael Butera with Alvarado Hospital joining us this morning to talk about what you can do to protect yourself and your family from the West Nile virus. Welcome. Thanks for being with us.
Thank you, Greg. Good to be here.
And a lot of people might be thinking, you know, hey, we've heard about West Nile. Why are we still talking about it?
Well, this is a virus that hit North America in 1999, initially in New York City, and by 2002 it spread across the country, and since 2003 we've been seeing cases here in California. The disease usually strikes during the late summer and fall, so this is the perfect time to be thinking about how to prevent getting sick from this particular virus.
And you were saying just this week, our first case.
We had our first reported human case of West Nile virus encephalitis here in East County, San Diego, the first in the state actually too, here in San Diego.
And for people who may have forgotten or who may not know, explain, it's a mosquito-borne disease. Explain exactly what the virus is.
That's correct. This is a virus that is endemic in birds, particularly crows and jays, and the cycle is between birds and mosquitoes that amplify the virus in the population of birds. People and other mammals can become infected as innocent bystanders, so to speak, but they don't participate in the perpetuation of the cycle of the virus. So humans and equines, horses, are also susceptible to illness with this virus.
So what can you do to protect yourself and make sure that you don't get the West Nile? Obviously, if it's mosquito-borne, you want to put some mosquito spray on, first of all.
Absolutely. So I think the first take-home point is that this is not a virus that spreads from person to person like the swine flu does. The most common way to get this virus is by being bitten by a mosquito, although there have been very rare cases of transfusion-associated and also organ transplant-associated cases of West Nile. The blood supply is thought to be safe now and is tested on a regular basis. All the donors are tested for West Nile. So the main way to prevent getting sick with West Nile is to really avoid mosquito bites if at all possible. I think the greatest risk in terms of the mosquito's habits is being outdoors, particularly at dusk and dawn. And if you're going to be out during these periods especially, one should wear an EPA-approved insect repellent, wear long sleeves, long pants, and you can also treat your clothing with an insect repellent called permethrins, which is not for the skin application. For the skin, there are a number of products out there, DEET being the main chemical that's preventative.
And you want to make sure your screens are, closed, and that, if you have holes in them, get them repaired, right?
Absolutely. To be a good public health citizen, you want to get rid of standing water around your house, infant pools, old tires, flower pots. Make sure there's no standing water in those areas. Repair your screens, because the mosquitoes can get into your house at night, obviously, through the screens and an open window. And again, the insect repellent. Another big issue I think we're seeing with the economic downturn is we have many bank-owned homes now that have pools that go green, basically are not chlorinated, and these could be breeding grounds for mosquitoes. So if you have bank-owned homes in your neighborhood, you may want to be aware of that. I think the county does a wonderful job in terms of what we call vector control and trying to seek out these areas of mosquito breeding and to control the numbers.
So if you do have one of those homes in your neighborhood, call county vector control and say, hey, this pool is green, and then the county will in turn then deal with the bank or whoever owns the home to make sure that that pool is drained and that there's no standing water, right?
Absolutely, yes.
And then we were talking, you were saying that 80% of the people who get West Nile don't have any symptoms.
Right.
Who is affected, that 20%? Who is that 20%?
So if you're bitten by the mosquito and you're going to get sick from it, somewhere between 3 and 14 days after you're infected, you might manifest symptoms. 80% of people have no symptoms whatsoever and will never know that they've had the virus. The 20% who become ill can have a mild illness that we call West Nile fever, and about 1 in 150 of those will have a more severe illness where the virus can invade the central nervous system, both the spinal cord and the brain, and we refer to that as West Nile encephalitis or meningoencephalitis, an infection of the brain. The main risk factor for getting clinical illness is age, so that most people under the age of 50 will not have any symptoms. If you're over the age of 50, and particularly over the age of 75, the likelihood of getting West Nile fever, having the mild symptoms, and particularly of getting the encephalitis is higher.
All right, so the top three things: you want to wear the mosquito repellent, make sure the screens are closed, and get rid of all that standing water.
Absolutely.
All right, Dr.
Yes,
Michael
sir.
Butera with Alvarado Hospital. Thank you so much
Thank
for
you.
coming in. Some great information. Now is
appreciate
the
it.
time that it's coming about again. All right. And of course, for more information, you can go to our website, san diego6.com.